Thank you for joining us for our talk today in Learning in Retirement. Our guest is Art Reingold, who I think many of you probably know. Art is a professor of epidemiology here at our School of Public Health at UC Berkeley. Art's worked for over 40 years on prevention and control of infectious diseases, the national level, internationally, and he spent 8 years at the U.S. Centers for Disease Control and Prevention. He's worked as co-director of the CDC-funded and continues to work for the CDC-funded California Emerging Infections Program. This is since 1994, since its inception. Also, more recently, he's been appointed as a member of the FDA's Primary Advisory Committee on Vaccines and Biologics, which has played a major role, of course, with the SARS-CoV-2 vaccine. Art's research interests include vaccine-preventable diseases, respiratory infections, bacterial meningitis, disease surveillance, and outbreak and detection and response. Art's published well over 400 original research papers on these subjects, teaches myriad courses at UC Berkeley, and is one of our most beloved faculty members. Finally, in 2003, Art was elected to the Institute of Medicine of the National Academy of Sciences, a singular honor. So Art's topic today is, when will anti-vax sentiment no longer be a problem? When the cows come home? Art, take it over.
Okay, so you can hear me and you can see my slides?
Yes, to both.
Great. So thanks everyone for joining. I hope this will be a very interactive session. It's a little hard for me to keep track of what's in the chat while I'm talking, but I'm more than happy to converse as we go along or do it all at the end in a Q&A, which I gather we have quite a bit of time for. So just to say, like many professors, I have too many slides, but most of them are going to go pretty quickly. So we will have plenty of time for discussion. So when John asked me to talk about when will anti-vax sentiment no longer be a problem, I struggled with the question of what to add to that in terms of the title. As this is a group that's perhaps closer to me demographically than most of the students I normally teach, I sort of hope that most of you are familiar with two phrases that I'm about to share. But I find I share almost no language or cultural references with my younger students these days. So I did what anyone would do, is I went to Google to see what the definitions were of these phrases as I was trying to choose. So the two concepts here that I was thinking about were when pigs fly and when the cows come home. And again, I would hope for many of you, these are expressions you've dealt with over the course of your life. They both imply that something is pretty unlikely to happen. Pigs flying, presumably hard to imagine ever happening. When the cows come home, the notion here is that you can keep doing something until the cows come home and it won't have any effect. And so fundamentally, both of these imply futility, or that something is never going to happen. I ultimately chose when the cows come home because of the relationship of vaccination to the work of Edward Jenner using cowpox, and thought that was more appropriate. But we'll get back to that. So, and I would just say that on April 2nd of 2024, vaccines and vaccine-preventable diseases are very much in the news. So you may be aware of the fact we're having a measles outbreak in the United States at the moment with over 100 cases. I think over half of them in Chicago. Measles, in fact, could be eradicated with the vaccine we have, but we're now having a nationwide problem and a global resurgence of measles. And if you read the news yesterday, you'll know we have the H5N1 influenza, avian influenza virus in cows now. And I suppose you could ask the question, if that became transmissible from one person to another and caused a pandemic like SARS-CoV-2 COVID-19, and we quickly had a vaccine, what kind of problems we would or wouldn't have getting people to accept vaccination. And clearly, over the course of the last few years in the context of COVID-19, both the US and other countries have seen quite a rise, if you will, in anti-vaccine sentiment and public demonstrations like the one here in Washington. Here's one in Canada. Here are ones in France, Germany, Austria, and Italy. So this is not a uniquely American problem. This is a problem certainly in wealthy countries around the world. And so it's something we should all be concerned about, in my humble opinion. And here you can see this is one going back to when the COVID vaccine was first released, and the whole question of mandated vaccination, which I'll come back to. Okay, so many of you are familiar with this history, but very briefly, the word vaccine comes from the Latin word vacca for cow, and the first vaccine that we had was against smallpox. Others had noted that milkmaids who had cowpox lesions on their hands seemed not to get smallpox, but Edward Jenner was the first person to, in fact, experiment and show that if he inoculated people with cowpox, that he could then render them immune to smallpox. The studies he did would certainly not pass IRB approval today, but it was obviously an earlier era. And here are lots of paintings of here's supposedly Dr. Jenner vaccinating young James Phipps, after which he then intentionally exposed him to smallpox, and James Phipps did not develop smallpox. And in fact, in 1796, Jenner, in fact, hypothesized or predicted that the world could rid itself of smallpox with this creation. Quite a bit of foresight, given that we didn't manage to do that for almost 200 years. And just to point out, as my beloved former colleague Warren Winkelstein pointed out, in the 19th century, funds were raised primarily here in the United States to put up a statue of Edward Jenner to celebrate and recognize his accomplishments. Statue was originally erected in Trafalgar Square. And if you've been to Trafalgar Square, you'll note that Jenner is not there because it was decided that Trafalgar Square was only suitable for people who had taken a large number of lives in war, not for people who had saved lives. So Jenner was moved, his statue was moved to Kensington Gardens, where you can see it today. Okay, so this won't be news to anyone. Over the course of the last 60 years or so, we've seen a progressive increase in the vaccines that we routinely try and give, in this case, children. Here you can see up to age, by 2016, the number had gone from 6 different infectious diseases up to 16. And this is the childhood immunization schedule in 2024. And you can see it's quite complicated. There are even more infections on this list for which we have vaccines. And of course, we have a separate schedule for adults, most recently adding the RSV vaccine, for example. And obviously, we've recently had a lot of experience with COVID-19 vaccines. So vaccination has come a long way since the days of Jenner. And here you can see in 1999, Centers for Disease Control and Prevention celebrated what they considered to be the most important achievements in public health of the 20th century, one of which was the impact of universally recommended childhood immunization, and basically showing for various diseases by 1998, the fact that basically many of these were gone. And here you can see the the declaration of victory over measles was obviously somewhat premature, but we did eradicate smallpox. We're close to eradicating polio, and as I said, we, in theory, can eradicate other diseases, certainly measles with the vaccine that we have. So that's the good news. And so this is just to highlight some of these. Again, the eradication of a disease that killed hundreds of millions of people, smallpox, the near eradication of polio. I don't know if John has, but I'm probably maybe the only person on the call who has seen acute paralytic polio in my work in West Africa 40 years ago. As I said, the close to the elimination of measles and congenital rubella, marked reductions in a number of other important diseases. So this is all a recognition of what vaccines can do for us. And now, this concern, this anti-vaccination concern that we're all aware of in the past few years is in fact nothing new. And I actually sort of had an interesting time going online to look at even more of the earlier anti-vaccination efforts than I was aware of. So at the time of Jenner in the 1790s, this was a cartoon that was published. And these are people who have received smallpox vaccine, cowpox, and are turning into cows. So you can see them spouting horns here, developing small cows growing out of their noses. This is another cartoon from that era. These are children being fed into this beast, if you will, of vaccination. And so anti-vax or concerns about the safety of vaccines go back to the time of Edward Jenner. Here you can see this was from around 1800, fear of vaccination, beware the vaccine, which is portrayed here in this carriage. Here you can see a poisonous tree as a metaphor for the effects of smallpox vaccination. This was in the early 1900s. So, and you can see many, many more examples if you go online. Interestingly, in the time of Victorian England, there was a close connection between vegetarians and anti-vaxxers who were opposed to smallpox inoculation. And some of you may in fact know, I grew up under the mistaken impression that being a conscientious objector in the time of the Vietnam War meant you had a religious or philosophical objection to going to war. But the term conscientious objector actually originated in Britain in the 19th century, people who objected to mandatory smallpox vaccination. So that's where the concept of conscientious objection originated. And here you can see in 1853, the British made smallpox vaccination compulsory for all infants on pain of fine or imprisonment of the parent. In 1866, the Anti-Compulsory Vaccination League was formed, and by 1871 had over 100 branches and claimed 10,000 members. 1880, the London Society for the Abolition of Compulsory Vaccination. So these concerns about vaccination and compulsory vaccination have been with us for a long time. Here you can see the National Anti-Vaccination League, again, the conscientious objectors, and even George Bernard Shaw, who I suspect some of you have read, pronounced that vaccination involved, quote, rubbing the contents of the dustpan into the wound. So Shaw was an anti-vaccination individual over 100 years ago. And just go through a few more of these. Here you can see death the vaccinator. So vaccines killing people, basically. Here you can see something from the newspaper about the National Anti-Vaccination League and the various distinguished individuals who were vice presidents of that league. Here you can see the kind of material they put out about opposing vaccination. Here So if you go online, you can find just a plethora of these materials from the 19th century. Um, with that as by way of background, I think we should acknowledge that reaction or response support for vaccination ranges across the spectrum. And anti-vaccination, if you will, in general, is at one end of that spectrum. So we have some people like me who actively demand vaccines for themselves and their children. And the more the merrier, if you will. That's a relatively small proportion of people. We have a large number of people who are readily accept vaccination because they understand its utility and its benefits. We have many people who are anxious about one or more vaccines, but accepting a vaccination once you answer their questions about safety. We have people who are willing to accept some vaccines, but not all vaccines, or to want them given on an alternative schedule, what they might call spread out, rather than being given together on the same day, because they've concluded that some vaccines are good, but others are not, or that combining them might be harmful. Oops, sorry. And then we have some people who truly refuse all vaccination. So this is a picture from my work for the Centers for Disease Control in West Africa, where there used to be very, very large epidemics of meningococcal meningitis. And John will know better than I do. Untreated, that disease has close to 100% fatality. Even treated, 10, 15% of people die. It's a medical emergency. And survivors are often left with severe lifetime disabilities. So when a new vaccine for that became available, people knew about this disease. They were fearful of the disease. And this is what people eager to get their children vaccinated look like, standing in line for hours at 100+ degree temperature because they fear the disease and see the vaccine as good. But that's active demand, if you will, for vaccination. Okay, so why might we have vaccine hesitancy or refusal? Well, some people have pointed out that if you're not, and I'll get to this in a minute, waning fear of vaccine preventable diseases, not only among the public, but even among healthcare providers, as I'll show you, growing fear of the vaccines, misinformation and rumors, which I'll come back to in the context of the internet, a lack of information, a lack of trust, I'll come back to this lack of trust issue, alternative beliefs about health and that some people might have. Often people believe that a child's illness or death or the death of a relative was caused by vaccination. And therefore they've seen with their own eyes, if you will, that vaccines are dangerous. And we'll come back to the issue of religious beliefs. So David Salisbury, who used to be in charge of immunization in the UK, has put together this little figure, which I like, and basically pointing out that if parents have no fear of vaccine but fear of the disease, the argument in favor of vaccination is clear-cut. If they have no fear of vaccine but also no fear of disease, there may be inertia. But when they have no fear of disease but fear the vaccines, parents or people are likely to refuse immunizations, and that's fairly logical, right? Trying to minimize the risk, if you will, for yourself or your beloved family members. This was a survey done a number of years ago, which I found very distressing. This is of healthcare providers in the United States. So these were mostly physicians, MDs, a few osteopathic doctors, and nurse practitioners, et cetera, of 700 healthcare providers. And while 90% perceived vaccines as efficacious and safe, only 29% perceived their patients to be at risk of the diseases vaccines are intended to prevent, and only 6% perceived that these diseases were particularly severe. And part of this relates to the fact that most of these providers have never seen any of these diseases. They've never seen a patient with acute polio or severe measles or a number of other diseases. So even healthcare providers who haven't seen these diseases don't really view them as particularly problematic. In this survey, which you can look at, more recent graduates of medical school were less likely to believe vaccines are efficacious and safe. They were more likely to believe that vaccines do more harm than good, et cetera. And so these are medical students. These are the people we hope will be promoting vaccination. And again, this partly has to do with who's teaching them and what's in the curriculum, and the fact that they've never really seen these diseases. So it's not just the general public that has lost its concern about many of these diseases. And of course, some of you may be familiar, we have providers. Dr. Bob is a provider in Southern California who have decided that the recommendations of, quote, experts on various committees and the like really are not necessarily the optimal approach. He has his own vaccine book with his own schedule, alternative vaccine schedule. You can see some rather odd statements from that book. Vaccines don't cause autism except when they do. I don't know exactly what that means. He seems to be interested in causality and coincidence. I don't know exactly what this means either. But he's one of the physicians who in the past was willing to give parents medical exemption letters to exempt their children from vaccination, even though the children did not really meet medical criteria for a medical exemption. That, by the way, has been outlawed in California, and we can talk about that. So religion, particularly in the context of COVID vaccine, we have many, many people who state that they have a religious objection to COVID vaccine relating to fetal cell lines or products from fetal cell lines that were used in testing the vaccines, in one case, growing the vaccine in the fetal cell line, but in the other vaccines, simply having been tested with reagents that may have come from a fetal cell line. Now, I will point out that we have Orthodox Jews in New York who object to vaccination. We have Muslims in Indonesia who object to vaccination, imams. So this is not unique to people who base their concerns about abortion and fetal cell lines, or Christians, if you will. This issue about religion comes up in a number of the world's major religions. If you're interested in this, this was a good article from 10 years ago, basically pointing out that none of the world's religions actually have a theological objection to vaccination. And we can come back to that, but maybe we have some people on the call who are theologians or can talk about religion better than I can. So if you're a reader of the New York Times, you're familiar with David Brooks. And this is something he said about trust 7 years ago, that basically people have lost trust in government, the media, the leadership class in general, and that they're willing to abandon truth. So having an expert from the Centers for Disease Control or the NIH or from UC Berkeley say that vaccines are good, that they're safe, that they're useful, doesn't necessarily convince people because they simply don't trust experts, if you will, or leaders at this point. And it goes beyond vaccination. So if people are not necessarily getting their information from legitimate government sources or experts, where are they getting their information, or in many cases misinformation? Well, from a whole range of sources: media, books, advertising, friends and parent groups, healthcare providers, the internet. And I can tell you, in the context of COVID-19, we have many healthcare providers, including physicians and nurse practitioners, who don't share my opinions about the safety and effectiveness of COVID vaccines or of other vaccines. So not all healthcare providers are in fact uh, agreeing with my point of view about this, and I'm sure we can talk about that. Now, I used to point out to students that in earlier days, if I wanted misinformation about vaccination, I had to buy a magazine on my way out of the grocery store. So here's one magazine of that era, the Natural Family Living magazine, Mothering. And here you can see this beautiful baby. And the question is basically, is there a connection between vaccines and autism? And I can assure you that in this particular article, the answer was yes, there is. Here's another one. This used to be a magazine for primarily targeting women. And here you can see one of the cover stories here, murder or bad vaccine, the question that ripped a family apart. And a child dies, and there are two alternative explanations. Either the parents murdered the child, or the child was simply the victim of a vaccine that killed the child. So in the old days, you could get all of this from magazines. Nobody buys magazines anymore, as far as I can tell. And of course, we had many, many experts on these topics, like Jenny McCarthy, a former Playboy model and MTV star, who became a passionate advocate for the autism being caused by vaccination. And many people listened to her sage advice. Here we can see a famous celebrity chef in Australia who promoted the paleo diet, but also was anti-vaccination and would make statements that dissuaded people from vaccination. And so now we're into a modern era, if you will, when we have the internet. And we have quite an interesting discussion about censorship of the internet. Can anybody control or decide what can and can't be on the internet? Maybe we have a constitutional lawyer on the call who can speak to the complexity of that issue. But people can easily go to websites. This one, I would venture a guess, to many people looks like it's a very official organization. The National Vaccine Information Center sounds pretty official, pretty governmental. This is an anti-vaccination website, and you might not know it from looking at it. But basically, this is an anti-vaccination website, and it is something that many people might go to and get what I would call a lot of misinformation. This is not just an issue in the United States, as I've already said. This has been a huge issue in Japan in the context of the HPV vaccine, also here in Colombia and in Denmark. Again, not limited to the United States by any means. And this is a slide going back 20 years. Looking at analyzing the content of what's on the internet, and at that point, and showing a range of anti-vaccination claims. Oops, sorry, that vaccines cause idiopathic illnesses, that vaccines erode immunity, vaccination policy is motivated by profit. Vaccine immunity is temporary or ineffective, and this has been a huge issue in the context of COVID-19, which I'll be happy to talk about. Vaccination policy violates civil liberties. The declines in infectious diseases were not caused by vaccines, but by other factors, which is partially true, and a host of other issues. And this was 20 years ago. Since then, there are many people who have made this their living, studying anti-vaccination material and information and the anti-vaccination movement on the internet. So here's just one article of 6 years ago about the anti-vaccination movement being mapped on Facebook. Um, and this is just the beginning of what is now not a cottage industry, but an entire industry. So there's a group at the London School of Medicine, Tropical Medicine and Hygiene, led by Heidi Larson, who received her PhD in anthropology here at Berkeley, and is arguably the world's leading expert on vaccine confidence and anti-vaccination efforts. So she monitors things globally on the internet and elsewhere in terms of anti-vaccination sentiment. Here you can see another look, if you will, at anti-vaccination tweets. I personally wouldn't know how to look at tweets. I'm not on social media, but here you can see between 2009 and 2015 that the percentage of anti-vaccination tweets varies a lot geographically within the United States, or at least it did back 10 years ago. So people study tweets and the misinformation that's there, if you will. And we have what the World Health Organization has called an infodemic, basically a pandemic of misinformation in digital and physical environments that can cause confusion and risk-taking behaviors that can harm health. It leads to mistrust in health authorities, undermines the public health response. And so we now have people who study, if you will, the infodemic, and particularly misinformation about vaccination. The world is filled with what I consider misinformation about vaccines. And so the question is, what can we do to overcome that? And the standard wisdom is that if we engage with the public, if we build trust, if we provide accurate information, that all of these will help overcome the problem. And of course, these are important. Perhaps getting parent or community groups or leaders in the community to take this on, if you will. Financial or other inducements, either to providers or to parents and adults, to get them vaccinated, as was done in the context of COVID, as I'll show you in a minute. And then we come down to compulsory vaccination, either with exemptions or without non-medical exemptions. And as we'll talk about that, these compulsory vaccine mandates work better than anything else on this list. But of course, they raise enormous concerns, as we'll talk about. So this is sort of, if you will, WHO's look at trying to deal with the infodemic, if you will. I don't know very much about this and how this might work, because as I said, I'm not on social media. There's the concept of pre-bunking. And pre-bunking is, again, basically trying to provide accurate information to people to prevent them from being influenced by misinformation, rather than having to debunk the misinformation, once they already have it. So this is, if you will, another way of thinking about providing people with information and hoping that they believe you and act on it. Here at Berkeley, we even have an expert in media studies, Professor Emma Fraser, who studies the media and is involved in looking at things such as vaccine misinformation. She's involved with one of our DRPH students working in Asia, in a primarily Muslim country, looking at vaccine misinformation and understanding that better. So we at Berkeley, we have experts who are studying media in this way. And increasingly, you will see studies like this that came out in December, identifying vaccine hesitancy among Twitter users, a scoping review. I haven't read these articles, but presumably they get into great detail about the misinformation that's out there and the hesitation among people about vaccines. Here's another look at this. from last February. So you can go online and read these types of articles that look at the social media piece of this. There are a couple of really good books I would recommend to people from about 10 years ago. One by a woman named Eula Biss and one by an MIT journalism faculty member, both of whom talk about as highly educated, reasonable people who are not anti-vaccination, the doubts and concerns they themselves had when it came to vaccinating their children. So just to show you quickly from Eula Biss's book, here you can see this was 10 years ago. Misinformation finds a host on the internet and it becomes immortal, if you will, undead, basically impossible to get rid of. But here you can see this was the question when my son was born, would I inoculate him? Now, she's the daughter of a physician and she's entirely well-educated and reasonable. As I understood then, this wasn't the question of whether I would protect him so much as it was a question of whether inoculation was a risk worth taking. And I think if you read her very short book, you'll see that concerns about the safety of vaccination, the wisdom of vaccination extend throughout society, including very well-educated, well-intentioned people. Every exchange was an extension of the already existing discussion about immunization in which all that is known of disease is weighed against all that is unknown about vaccines. So again, just pointing out that highly educated people may have these same concerns. I love this headline. This was a man who apparently had 217 doses of COVID vaccine. And the good news is, doesn't seem to have hurt him any. The suspicion is that he did this because financial incentives were being offered to get a dose. So he got a lot of doses so he could get a lot of financial incentives. And no monitoring of how many doses a person was getting. Showed up, got vaccinated, you got some money. So this, I suppose, is an over-exuberant acceptance of vaccination and does speak to the question of giving financial incentives to people to be vaccinated. And currently, of course, we have the concern about what to do about the movement, and even the White House just keeps hoping it'll all go away. I'm quite doubtful that that's a good strategy. So let's talk a little bit for a couple minutes about forced vaccination, coercion. And so going back to smallpox eradication, the fervor of people coming from wealthy Western countries into low-income countries with almost a religious fervor to eradicate a disease led to a number of quite coercive and situations of forcing people to be vaccinated. In this particular case, this is actually a friend of mine who Larry Brilliant is here in the Bay Area, and basically talking about breaking into the hut of a married Indian woman, husband leaping out of bed. This was to give them smallpox vaccine. The husband leaps out of bed, grabs an axe, chases the intruder into the courtyard. Outside, a squad of doctors and policemen overpowered him. He was pinned to the ground, vaccinated against his will. And then as soon as they let him up, he grabbed a bamboo pole and started attacking them. So I think it's fair to say this approach to forced vaccination would not go over well in Marin or pretty much any other part of the United States. And this kind of over-exuberant commitment to getting people vaccinated, whether they wanted to be vaccinated or not, clearly is not what we want to be doing anywhere. And this just speaks in Somalia to the fact that the immunization teams would be dropped on one side of an area, picked up 2 to 4 days later on the other side of the area, as sustenance and safety from lions at night during transit through the desert depended on contact with nomadic groups. Searchers were unusually effective in contacting nomads during transit. So this is a way of getting vaccination teams to really cover the area they're supposed to cover by putting them at risk of being eaten by lions. So whether it's the people you're trying to vaccinate or the vaccination teams, this kind of coercion presumably is not the approach we want to take. Many of you know that a very famous decision 100 years ago, the Jacobson case in the Supreme Court, basically upheld compulsory vaccination by public health. This was smallpox vaccination, and this was in 1905. And this has been an important precedent for the last 100 years, basically saying that government could coerce people into being vaccinated. Although many people believe that the current Supreme Court, if they revisit this issue, not only will move away from this precedent and move away from compulsory vaccination, but could in fact invalidate many compulsory public health laws around isolation and quarantine and many other things if the cases are brought to them. Well, this is just an anti-compulsory vaccination pamphlet from 1929. So compulsory vaccination in the United States has been a contentious issue for a long time. Here you can see different points of view about vaccine mandates, that compulsory vaccination diminishes autonomy, is an unwarranted and inappropriate government intrusion on parental decision-making. Here you can see the British Medical Association said it wasn't appropriate for the UK and is counter to the core principle that vaccines should be administered on a voluntary basis. And even John Stuart Mill basically said that the only purpose for which power can be rightfully exercised over any member of a civilized society against his will is to prevent harm to others. His own good, either physical or moral, is not sufficient warrant. And this comes to the question of whether, in the case of COVID vaccine in particular, if the COVID vaccine protects you, but does not reduce transmission to others, is there a basis for compulsory vaccination to protect the community? Let me just say, COVID vaccination does reduce infection and transmission to others, but people have raised this issue that you can't force me to be vaccinated just for my own good if it's not if it doesn't have wider benefits in the community. So this is an issue we can talk about. Again, you can see that the issue of mandates are an American tradition, and so is the backlash. Many of you are familiar with the most recent information that a number of states, here Texas has barred COVID vaccine mandates and basically said that private employers cannot mandate COVID vaccination for their workers. This has been done by many, many companies and organizations. Here you can see the Surgeon General of Florida, amidst this measles outbreak, has taken a very different approach and basically said that unvaccinated children can go to school in the midst of a measles outbreak. So state by state, we're seeing very, very different responses. Here you can see, interestingly, the first two states to have childhood immunization mandates with no philosophical or religious exemptions. The first two states were West Virginia and Mississippi. California was the third. And here you can see in Mississippi, people are challenging vaccination mandates for children to go to school, and that the children should be allowed to opt out, or parents should be allowed to opt out on religious grounds. So all of this is being litigated in states across the country at this point, the issue of mandatory vaccination to go to school. So I'm going to sum up, and I hope we'll have a good discussion. Anti-vax sentiment will no longer be a problem in my estimation when the cows come home and when pigs fly. In other words, I'm pretty pessimistic that this will go away, at least in my lifetime. But I do want to leave you with a ray of hope. I often am driving in Sonoma County, and I often drive past a farm that has this sign. So it's Pigs Fly Farm. Here you can see, I don't believe they have any winged pigs on this farm, but this is the name of the farm. And so maybe we can look to a future when pigs do fly and when anti-vaccination sentiment is no longer a problem.